So thank you very much for doing this, Kreena. For everyone who's watching, can you tell them who you are and what you do?
Yeah, so my name's Kreena Patel. I am currently a specialist in endodontics. So I work part-time in practice. I work in Croydon and in Reading. So my week's split between two practices. And I also teach 1 day a week at King's College London on the MCLIN Dent programme. So that's the endo speciality programme that we have there. So it's nice to have a little bit of a mix. And then I do a little bit of education and teaching on the side as well.
So loads of different things.
Yeah, keeps my week interesting.
Yeah. And so is it a case that you kind of know 2 weeks are the same, or will it be, do you have kind of very specific days that you're doing things?
Yeah, every week's the same. So I have Mondays off. Tuesdays I'm in Reading. Wednesdays I teach over at King's, and Thursdays and Fridays I'm in Croydon. If I'm running any courses or anything like that, it's a little bit ad hoc depending on when they're running. But otherwise every week is the same. Which is nice.
Remind me, what is it you do in Croydon again? You just said.
I'm a specialist, so I work in private practice.
Oh right, okay, yeah. So
it's mainly a referral-based practice. So working with general dentists, I do the endo part, and then back to them for the restorative part. Nice.
And so what kind of things will you do? Is it just doing, primary or secondary endos that you do, or is it kind of is there surgical stuff involved as well? And what kind of, from the endodontic specialist point of view, not the teaching point of view, what kind of things will you take on?
Yeah, so I mean, one of the reasons I love endo is because it's very rare, very varied. So it can be nice and simple endos that I get referred, where dentists, they don't like endo, or they want, the patient to have it done to the best success rate possible. It can be repeat treatments. I would say probably mostly primary endo is what I end up doing, probably about 40% retreats. But endo also covers endodontic surgery, which is something I love.
So like apicectomies and things like that.
That's it, yeah. So apicectomies and also surgeries for resorption. So, for example, external cervical resorption. We quite often, if it's restorable, we mend that surgically. So it includes those surgeries. Occasionally, I'll be carrying out crown lengthening surgeries for patients with difficult teeth to restore, because I find it's quite nice having that done in one session by one person rather than being split. I won't do any very sort of aesthetic cases or anything like that. This is purely, to retain function of teeth. And also a lot of, there's a lot of consultation, so diagnosis and treatment planning. And occasionally I'll get pulp capping procedures, so caries that's deep to the, very deep, the dentist's not sure if we could get away without doing endodontic treatment. So sometimes pulp capping, not very much of that, but a little bit. And that's pretty much my week. So,
and what is it you enjoy about endodontics in general? Because it's one of those where you're kind of doing one procedure for a very long time with the patient who can't really talk back to you. Is it the kind of thing where you just enjoy getting lost in the zone and concentrating on such a small area? Because I find it really fiddly, on some cases.
Yeah, I mean, a lot of people don't like endodontic treatment. I really love it. I find that because it requires a lot of technical precision, and I like doing that. I like spending my time on something and sort of completing it and having a nice radiograph to look at the end, although that can be stressful when things don't work out. But, it's very fulfilling, I find. I do like how varied it is as well. So, as I mentioned, it's quite, it's reasonably broad in what it covers. And I mean, normally what I do in my surgery is I turn my music on, patient's got rubber dam on, and I just concentrate on what I'm doing, and the patient loves it when the music's on, I love it when the music's on. And you can work with four-handed dentistry a lot in endodontics, so you've got a really good teamwork with your nurse as well. So lots I love about it. I think it's the best speciality out there.
I think endo is one of those things where, for me, the better I've got at it, the more I enjoy it. So things that I used to hate about endo, I can now look at those cases and think, oh, I'm looking forward to giving that a go.
Yeah, I think endo is all about practice, actually. The more you treat, the more, the more progress you make, and then the more you start to enjoy it, because, initially you struggle to find canals, then you learn how to find canals, and then you learn how to find the difficult canals, and all of that progress is things that, people really enjoy when it comes to endodontics.
Amazing. And you were saying you're doing some teaching stuff. What does that look like? So what kind of teaching stuff are you doing? What kind of age ranges? Is it just all undergraduate stuff or postgraduate things?
Yeah, so I mainly teach on a postgraduate basis. I do a little bit with the undergraduates at King's, but I'm mainly a postgraduate tutor there. When it comes to lectures and courses that I do outside, it's all postgraduate courses. I've done a couple to the DF1s in London, so I do a little bit of their teaching as well. But mainly it's courses. So I run a couple of courses for eWisdom. I'm starting up my own Endo online course, and then just lectures for groups like, for example, BDA, Dentsply. So it's just a few outside courses for postgraduates.
Nice. I went to one of your BDA. You did a young BDA thing in Reading. I came along to that actually.
Oh yeah, I do recognise you from there. Yeah.
So it's obviously something you're very good at, and it's something you enjoy doing because it takes a lot of time to put together the content. So I think that's something people don't really appreciate.
Yeah, it does. It takes up evenings and things like that. It's one of the main reasons I used to work a 5-day week, and it's one of the main reasons I started to take Mondays off actually, because that's when I focus on my content, because otherwise it was spilling over into weekends and evenings. So I'm trying to have a bit more of a work-life balance. So that really helps. It does take a long time to put the content together, but then once you have it, for example, videos and things like that, you've got them for for anything that you do teaching on. So I quite like collecting my work together anyway. So I post a lot of my things on my social media page and things like that. But I find it not only nice that you can educate people, but also you learn a lot from yourself. So I always recommend for young dentists to do that. I mean, right from my DF1 year, I was taking photos of my work, and initially, it wasn't very good, but it's a photo that makes you learn because you can analyze it. In the patient's mouth, you're stressed, or you only have a certain amount of time, but with a photo, you can say, oh, that crown margin wasn't quite right, or on an endo, for example, you look at a radiograph and you think, oh, maybe there's another canal there. So I think, I quite enjoy doing it and analysing my work as well.
Nice. And I guess with having specialised, this probably lets you do more teaching than if you'd just done, a PG diploma or something like that. Is that one of the reasons that you wanted to do this speciality and do the whole way, or?
I think the reason I decided to go the whole way was during my DF2 year, I was around a lot of specialists. So I did a peds post and an oral surgery post. And it was just looking at the quality of care that they produced. So I just found that, they knew exactly what they were talking about. They were, talented in their field. And for me, I thought, I want to be really good at one thing. And I think the specialty program allows you to do that because unlike some of the other programs, you're working on patients. So you're working with top clinicians. If you get stuck on something when you're working on a patient, that the tutor will help you out and you learn much better. Whereas for the diplomas and the MScs, quite often a lot of it is theoretical based. So I feel like with endo, you can't learn as well when you're learning from a textbook as compared to on a patient. And some of it's on extracted teeth, and extracted teeth are fantastic to learn on, but it is very different when you're working on a patient. So I just think it was really for me that the tutors that I would be working with and the patient experience that I'd be getting. And I think there's not really anything like that out there apart from the specialist program if you want to do it to that level. And I think that therefore, helps you get into teaching a little bit more. Although, I know a lot of people with diplomas and MScs that do a lot of teaching and they're fantastic teachers. So, it's not that you can't do it, but it's just a little bit, I think if you, it's a bit different.
Yeah. And so could you kind of give us an overview of what endodontic speciality training looks like? So how many years is it? What kind of things do you cover? Is it quite hands-on?
So specialty training, I did mine at King's College London, and it's usually it's either 3-year full-time, which mainly international students do, or a 4-year part-time, which allows you to work at the same time. So you are able to work. The fees are fairly high for it, so it's nice to be able to work at the same time. And literally from year 1 to 4, you're treating patients. So normally the students will have a consultation clinic. where they'll see patients. You've got a consultant or a clinical teacher on there, so that's where I teach on. So they'll do the diagnosis and treatment planning, and then they'll come to us and we'll go through that plan with them. So you're seeing a lot of interesting cases, things like invaginations, dens invaginatus, surgery cases, lots of funky anatomy, working with CBCT. So you're learning all of those sort of skills during the diagnosis and treatment planning side. And then I think you've got about 3 or 4 clinical sessions a week as well, where you're treating patients. So that's pretty much 2 patients per session, and treating them. If you get stuck, then your tutor is there. You've got a lot of guidance as you're proceeding through. There's also quite a lot of theory that goes alongside it. So each week you have seminars, and there'll be quite a few papers to read for that. So you read those, and then with a tutor again, you'll go through all of those papers. There's exams. I mean, for King's, I can say there's exams in the 2nd year and in the final year. And you put together a portfolio of cases which you present as part of your finals as well. So that's a varied selection of cases that you'll have treated during your time. And so you sit the MClin-Dent, which is the university exam, and then you sit the M-Endo, which is the Royal College of Surgeons exam. So it's a little bit confusing actually with specialty training. You have to do an MClin-Dent, which will lead you to be able to sit the M-Endo exam.
Right. Okay. I didn't know that myself. Okay. Right.
Yeah. So there aren't that many programs out there that allow you to do that. In London, it's the Eastman program at UCL and King's College London. So those are the 2 in London. And then I think Liverpool do one as well. Manchester do one, but that's mainly international students as well. So I might have missed a few programs, but those are the ones that I know about. But you do have to, it's because you can get distance learning MClin-Dents as well. And they don't allow you to sit that final exam. So you do need to make sure that you pick the right program to allow you to sit the M-Endo exam.
So don't assume, because you've done an MClin-Dent, that you're going to be able to go and then become a specialist at the end of this. You need to do your homework first.
That's it, definitely. Yeah, speak to people that have done the programs and then go from there.
Okay. And with getting onto these training programs, is it a case of, I'm sure it's not a case of you come out of dental school, you do your VT, and then you kind of apply for one of these programs. What kind of things can you do in those years where you're learning some general dentistry skills that will help you to get onto a program, a training program? What are they looking for?
So the endo specialty program is quite competitive. So definitely there's some work to do. Things that they like are, I would say, publications. Everyone says that, but it's so hard to get published, isn't it? But I think publications are a great one if you can get involved in, even if you ask someone like a mentor to help you and you can write the article together. Publications are fantastic. I would say keep a portfolio of your work. So you know exactly what you've done, the numbers of everything that you've done. I would go on courses, so potentially some more advanced endo courses where you can learn rotary instruments, maybe a variety of rotary instruments, different obturation methods, things like instrument removal. I mean, no one's expecting you to have those skills when you go in, but it's always nice at an interview if you can show that you've had that interest, that you've actually got, you've gone out there, done some extracurricular activity and got a good interest in what you're doing. You know exactly what it's about. I would say even microscope courses are really good, so you have a good feel, because I think that's one thing with endo that is very different from every other speciality. You spend half your life looking down a microscope, which is definitely not for everyone. So go and try one out, see that you like that. Other things are audits. They like that you've done audits, so nice and boring, but make sure you've done those. I think those are some of the things.
Different in what you're saying to the oral surgery talk that I've had is, in the oral surgery talk, I think they were expecting a little bit more of a kind of like a rounded dentist. So go and do some ped stuff, go and do some ortho stuff, go and do some restorative things, and that's what they want to see when you go on to an oral surgery. But it sounds like with an endodontic program, what they're looking for is mainly that, look, you've shown an interest in doing this in the first place, and this isn't just something where you're thinking, all right, I want to specialize in something, let's give endo a go.
Yeah, no, definitely. I think you need to show definite interest in endo. But I would also say, you know, similar to the oral surgery program, they do want someone who's rounded. So endo is part of restorative. So restorative is very important, you know, that you've done prosto and perio as well, that you're competent in all of those. And even during the program, some of the cases you present are multidisciplinary. So you've got all the restorative specialities in there that you need to present. So I think you need to have a good round base of dentistry as well. I would say, especially for endo, oral surgery is quite important. So the ability, you know, to be able to raise a flap, because we could go straight into more advanced surgical concepts. So I think it's very good to have a little bit of oral surgery experience. People often ask me, you know, do I need to have a DF2 job before I go in? And the answer is no, you don't. But I think it does show, you know, that you've done a little bit more advanced work in hospitals. So I think it is a good thing, but it's not a must. I think having a couple of years in general practice is just as good. If I was on the panel, that's what I'd be looking for, because I think it does show that you're quite rounded as well.
And on your course, when you were going through your training program, I mean, how big was the program? How many people were on it with you? And do you get to know them quite well? And then the second part to that is, are they all just kind of people who are young dentists, or do you going to get people who are 10, 15 years out thinking, do you know what, I want to go back and do this?
100%. I think I was the youngest person on there. Yeah, so a lot of the people, so I had I'm trying to think, I think there was 3 home students, 3 or 4 home students on our program, and 3 or 4 internationals, and that's about right. So you're a very close year. There's usually about 6 to 10 people per year, and you get to know them very well. You become good friends. So yeah, it's lovely like that. You lean on each other for a lot of support. So yeah, I mean, definitely small years. I think they have got a little bit bigger since I've been doing it. So I think last year maybe there was 5 or 6 home students. But yeah, I mean, it is a small year. What else did you ask me? I've forgotten.
Age wise. So
yeah, I mean, yeah.
Thinking, look, I want to go back and do this properly.
Yeah, no, I mean, I think majority actually, when it comes to endo, are a little bit older. So about 5-6 years post-qualification. So yeah, I mean, you have got people that are younger. So I did it 3 years out of graduation, but like I said, I'm one of the youngest, and even when I'm teaching on it now, I'm younger than a lot of the postgrads that are there. A lot of them have done diplomas and MScs before they've decided to go and do the full program.
Interesting. So they've kind of done these other courses and thought it's still not ticked all the boxes that I wanted for what I need. Right. Okay.
That's it. Yeah. I mean, when I did mine, I think one person had done a full MSc before. One had started an MSc. So it is, there is people that have done that prior to starting.
Okay.
Yeah. But it shows it's quite competitive as well, I guess.
Yeah, absolutely. So what kind of tip, we'll finish off with, what kind of tips would you give people who are looking to improve on their endo? So what kind of basic things could people do, or could everybody do, to improve their endo?
So I think the first thing is equipment. I was thinking about this, and I was thinking, what's the sort of cheapest things that you can buy that had a significant impact on my endo ability? So the first is a DG16 probe, which is a much sharper, longer probe. People for endo tend to pick up their normal dental probe, and it's not long enough to look for calcified canals. So I would say DG16, front surface mirror, which again, they're not very costly, but will make your endo significantly better. You can suddenly see what you're doing. Say that again.
What's a front surface mirror?
So for normal dentistry, we use what we call a rear surface mirror. So if you put your probe onto the mirror, you'll see there's a little gap before you can see it in your mirror.
Okay.
Whereas a front surface mirror, if you put your probe onto the mirror, you'll see that the tip of the probe will touch directly the tip of what you're seeing in the mirror.
Okay.
So you don't get a double image. And people don't realize how important that is, but for endo, it's amazingly important. So front surface mirrors, and an endo Z-burr, I would say is really good. So that's a flat-ended burr. So as soon as you gain access into your pulp chamber, you can switch over to this blunt-ended burr and enlarge, you know, your access cavity without damaging the pulp floor. So I'd say those are the three sort of cheapest things that will have a dramatic impact on your endo treatment.
Amazing.
I think loops and magnification are, and a light, you know, are really, really important. So invest in yourself, and I would say buy those.
Yeah.
And the last tip is, when I'm teaching at the undergrad, you know, the undergraduates at King's, they don't use very much hypochlorite, so they're using the tiniest bit, you know, coronally. So I would say, you know, whatever you're using, double it, because that has the most significant impact on endo. It clears all the debris out, makes you not block your canals, and you know, your success rate will be higher.
How many? Say if you were doing, you know, multi-rooted molar. How many cartridges of, or how many lots of hypochlorite would you go through on a typical case?
Probably, I mean, it's difficult to tell because my nurse always switches them over. We've got 2 going at the same time, but I would say at least about 8.
8, yeah. So if anyone's using kind of 1 or 2, they are way off.
Yeah, exactly.
One thing I actually wanted to sneak in, if you don't mind, is courses. So you're a specialist now, you teach, but I mean, you must do some courses. And what kind of courses do you look for now? And what courses have you been on where you just thought that's an amazing kind of couple of days?
So my last one I went on was the Terrucci course. So Terrucci is a guy from Japan, and he did his PhD on instrument removal. For dentists. So he's revolutionized the field a little bit. Actually, the way he removes them is a little bit different to how everyone else does it. He's got his own kit. So the last course was a day course on his teaching methods,
in Japan,
which I found were really good.
Did you go to Japan for that?
No, I wanted to. Yeah, I mean, we were planning a trip to Japan in June, so I nearly booked it there, but thank God I didn't. No, he came to London. It was the first time he's ever come to London to teach, so I luckily got a place on that course.
Yeah, brilliant. You can take out all my fractured files. Wicked. Well, thanks so much for that. There's so many little tips in there.